This video popped up on my For You page, and as an ICU nurse who has taken care of so many people that have been on ventilators, I wanted to talk about it. First and foremost, I want to thank Katie for sharing this video. I think it's very, very important as nurses, especially ICU nurses who work with ventilated patients, to know how overwhelming and scary it can be to be on a ventilator. Well, it's very normal and common for us to take care of people on ventilators, and it's, just our common day-to-day work. It's a very scary experience, or can be a very scary experience for other people. So there's a couple things we can do to help people communicate better when they are on ventilators, and I wanted to share those things. I unfortunately have seen a lot of nurses that can get frustrated when patients are trying to communicate things and don't always take the time to necessarily try to understand what they are trying to tell us. I just don't think that's right. I disagree with that. When people have a ventilator in, they cannot talk, they cannot verbally speak. The patient has a breathing tube that is going down their throat, down into their lungs, and that impacts their vocal cords, making it so that they cannot speak. They can mouth words if they are awake enough to mouth words, but it's very difficult to mouth read and lip read someone that's on a ventilator because they have something in their mouth. And so it's a difficult thing to do. A couple ways we can help patients communicate are by using these different types of letter boards. This is nice because the letters are big and patients can point things out to spell them. You can also give patients like a pen and paper to try and write things, or a whiteboard to try and write things on. But sometimes it's a little difficult, especially when someone has maybe been on sedation or they've been on a ventilator for a couple days, and so they're just a little bit weak and they don't have those fine motor skills to write. This is another great option, is using a board that has a bunch of pictures, so someone can kind of just point to something and tell you what they need. In the video that Katie posted, she was actually writing on someone else's hand letters to try and communicate. These boards kind of help out with that. At the end of the day, I always tell my vented patients that are trying to tell me something or talk to me about something, if I'm not quite understanding it, maybe we've tried writing, or sometimes we've tried these boards and they're, maybe don't have the strength, or they're not able to comprehend it. I always try to reiterate, like, I'm trying to figure out what you're saying. I promise, like, we'll figure it out. We'll get there. Sometimes it just takes a little bit of time for me to figure out what you need, but I promise, like, I'm going to keep at it until we both are on the same page. I think the more that you can communicate with someone and give them that reassurance that, like, I know this is scary, you're doing a great job. It just gives them that little bit of, like, reassurance that they're okay. So thank you again, Katie, for sharing your video. If you guys have any questions, I'm happy to talk more about this.